Obviously, I'd like to not only thank the witnesses, but again, thank the chairman for holding what many here in this room and many here across this country consider a very important hearing. Obviously, it's important to the families in my district on the Central Coast of California who are very worried about their health care. And we all understand that the Affordable Care Act was clearly an important step in the right direction. We also know that there's a lot more work to do. Unlike 97% of California's residents, many of my constituents are unable to shop around on the individual market in order to choose the best insurance for themselves and their families. In 2 out of the 4 counties in my district, Monterey and San Benito counties, there's only one insurer on the exchange marketplace. As you know well, that lack of choice sharply increases premiums, puts many of my constituents in high deductible plans, and it creates a lot of high out-of-pocket expenses. To make matters worse, Congress reduced the individual mandate penalty to 0, and the Trump administration proposed policy changes that would promote insurance plans that do not meet CBO's definition of health insurance. These actions have left many of my constituents without health insurance and actually provided limited options for many of them who want to seek insurance on the marketplace. Can any of you explain what role the Trump administration's expansion of short-term limited duration STLDs, as we know them, those types of plans and association health plans, what they have played on expanding coverage in the individual market, in that sense that have these actions increased access to quality health insurance, or have they helped people with pre-existing conditions? You can talk about that.
So we believe that short-term limited duration plans will become more common starting this year because of the change in regulations. Some of those plans will not provide coverage that meets what we consider to be coverage. Our definition includes a plan that provides some comprehensive major medical benefits, that is, would cover a serious illness. So some of these plans have limitations on what they pay, and so we don't consider them coverage. However, we do think some of them will continue to provide major medical benefits, often with very high deductibles, even higher than those in the marketplace. They are underwritten to these. They will sell them to everybody, but if they decide you've used that coverage for a pre-existing condition, they may not pay that bill retroactively. Right now, those plans are small in number. We estimate fewer than 2 million.
Understood. Great. Now, in my area, there's obviously a good amount of rural area, and so we have a lot of rural hospitals as well. I was wondering if you could address what a single-payer system would do to help reduce costs for these types of hospitals in those rural areas.
So, many rural hospitals, I don't know about your district, are in, they're called critical access hospitals, and they receive higher payments than would be otherwise provided under Medicare because they're recognized as critical access. They often treat a lot of public pay patients as well as patients who are uninsured. It is possible under a single payer that some of those rural hospitals would actually be better off and get more payment for their patients than they do today because some of them are uninsured.